Hi guys, I'm Dr. Tara Tobias. I want to welcome you all back to my channel. In today's home exercise tutorial, we are going to talk about shoulder subluxations. So I do get a lot of comments regarding this and how do you treat it and what are the best exercises for it. And I've never really done a video devoted just to specifically shoulder subluxation. So I thought that's what we would go over today. So what we're going to do is we're going to talk about, first of all, what is it? How does it happen? How do you prevent it from happening, and how you treat it. So a lot to cover in this video, but before we dive into all of that, if you haven't yet subscribed to my channel, go ahead and hit that subscribe button, turn on that notification bell so that you'll be notified every time I upload new videos. And now let's go ahead and dive into this topic. So first and foremost, what is a shoulder subluxation? So the definition of a shoulder subluxation is when the arm bone or the humerus partially drops out of the shoulder socket. So the shoulder is what we call a ball and socket joint. So the arm bone is shaped like a ball, the shoulder is shaped kind of like a bowl, and the arm bone in a normal healthy shoulder is supposed to sit pretty much right inside that bowl so that when we lift our arm or when we move our arm in any direction, really, ideally, that ball or the head of the arm bone is really just rotating inside the socket. That's under ideal circumstances. Now, I touch on this a little bit pretty much in any video that I do on exercises to regain movement in the shoulder, but there's a lot of factors that can interfere with that ball and socket relationship. And one of those factors is a shoulder subluxation, which is when the head of the arm bone drops a little bit out of the socket, not completely out of the socket, because then we would call that a dislocation, but just partially out of the socket. So that's more or less sitting on the bottom rim of the cup. And then of course you lose that nice relationship of that rolling or that gliding inside the cup, or the ball loses that ability to roll or glide nicely inside that cup. And usually you'll know you'll have a shoulder subluxation because when you look in the mirror, one shoulder is going to look nice and round over this part of the shoulder right here. And what you might notice on a shoulder that has a subluxation is that you're not going to have this nice rounded corner more or less on the shoulder, but what you're going to have is you're going to have like a little divot. So you're going to see, instead of like a nice corner where the shoulder kind of drops off into the arm bone, what you're going to see is a little tiny valley in there. And in therapy, we measure this by fingers. So 1, 2, or 3 fingers, however big that valley is, that will kind of determine the severity of the shoulder subluxation. So that's how you would know you have this, but hopefully you're working with therapy and someone has already identified this as a problem with you, and so you've already heard this term before. So hopefully that just gives you a better understanding of what actually this is and what mechanically is going on at your shoulder if you do have a shoulder subluxation. So now, what causes this to happen? Well, as many of you probably already know, after a stroke you end up with hemiplegia or weakness on one side of your body, depending on where the damage is in the brain or where your stroke occurred in the brain. And the primary stabilizers in the shoulder are muscles. So basically what happens is you have that weakness that decreases the integrity of the ropes that are holding that arm bone in the socket. That combined with just a prolonged downward force, which is really just gravity and the weight of the arm bone over prolonged periods of time, will cause that arm bone to slowly fall out of the socket. Now there's other things that can cause this to happen. Poor positioning when you're laying down, so there is an ideal position that you want the arm in. And then the really big preventable one is people holding your arm or pulling your arm when they're helping you to transfer. So that's another big potential mechanism that could cause you to develop a shoulder subluxation. So now structurally, what does this do to the shoulder aside from the stroke? So we know from the stroke, as I mentioned earlier, you have weakness in those surrounding muscles. But now what does a shoulder subluxation do mechanically to the shoulder? Well, there's a capsule that also helps to provide a little bit of stability to the shoulder and keep that arm bone in the socket. You lengthen that capsule out. That gives you more instability in the shoulder. And then what happens is you get some over lengthening of some of the what we call rotator cuff muscles, which are the muscles that hold that arm bone in the socket, making them less efficient or making it harder to activate those muscles. That is going to be kind of an added barrier or potential added problem when you are trying to do active movement with the shoulder or regain active movement of the shoulder. Now, there's another issue that I don't think is mentioned enough when people talk about like shoulder subluxation after a stroke, but I mentioned that cup part. That's part of the shoulder blade, and I feel like this gets missed a lot in therapy. Under normal circumstances, that cup part of the socket is pointed either straight out or even a little bit upward. So if you think about a bowl and you think about a ball, trying to keep that ball in the socket, if it's pointed a little bit upward, it's going to be easier to keep that ball in the socket. After a stroke, because of weaknesses and tightnesses in other areas of the body, specifically muscles that attach to that cup part or that shoulder blade, what happens is it starts to fall, and it actually ends up being positioned downward. So that also contributes to that ball just kind of falling out of that socket. So I hope all that made sense, but that is kind of what a subluxation is and how it happens. So now, how do you prevent this in the first place? Well, it really starts when you're in the hospital. Hopefully, if there's any of you caregivers out there where your family member might still be in the hospital, this would be beneficial to you, but I do think it's worth going over. The best way to prevent it is to educate every single person that interacts with you if you've suffered a stroke, or that interacts with your family member if it's your family member that suffered a stroke. Everyone needs to understand that that shoulder is really unstable and needs to make sure that they do not grab the arm. It is so tempting to do, especially if someone looks like they're losing their balance or they look like they're falling. It's just a natural tendency. It's kind of like an appendage. It's kind of like something that's just sticking out there, just calling your name to grab onto it when someone's falling. But you really need to just ingrain it in your head that you just try not to ever grab the arm. Make your reaction if someone's falling or losing their balance just to grab around their trunk if they don't have a gait belt on. And if they have a gait belt on, that's the best case scenario, because then you just grab onto that gait belt. So the other way to prevent this from happening is positioning. In sitting, for sure, remember I said that it's that prolonged, sustained, like downward force of the arm bone that causes it to fall out. So in sitting, you want to have that arm supported. I am a fan of arm troughs. An arm trough basically just goes on the armrest of the wheelchair and it supports the arm so that you eliminate that prolonged downward force of that arm bone. There's a variety of them out there. I like the ones that you can adjust the angle so that you don't have the arm like this and you don't have the arm perfectly straight, but you can have the arm kind of in a more natural position. Now, if you don't have insurance or you don't have the money to purchase an arm trough, pillows work as well. You definitely want pillows in the lap as well as kind of on the armrest. You don't want to rely on the armrest. The armrest is really narrow, and in most cases, what I notice or what I walk into when someone is using their armrest to support their arm is their arm has fallen off the armrest, and if it falls outside of the wheelchair, there's potential to even cause more damage to the arm. But it really, you never see anyone with their arm supported on an armrest. They're just not big enough, and eventually the arm will either fall to the outside or fall to the inside. Falling to the inside is just as bad because you are getting that prolonged downward force, but now what you're also doing is you're allowing the shoulder to drop a little bit, causing more problems with that bowl tipping downwards that I had mentioned earlier, and you're just going to end up with a lot more tightness and other issues that are going to become a problem when you work on motor retraining down the road. So definitely having something on the armrest to support the shoulder is extremely beneficial. And then in standing, I'm not a huge fan of slings in general. So a traditional sling that most people think of, it just puts the shoulder in a really bad position. Now, if the arm is super duper unstable and it's falling out almost immediately when you take the support away from the arm. To use it for transfers is okay, but as soon as you're not standing, definitely go to some of the ideas that I mentioned earlier to position that arm. Again, it just causes a ton of tightness, and it does present a lot of issues down the road with the mechanics of the shoulder. So I'm not a fan of the sling. So I just want to clear the air on that. I've mentioned it in probably a few videos, but I thought it was worth mentioning again. What I do like is what they call a give more sling. A give more sling basically supports the arm from the hand. So it does not work with someone who has a lot of flexor spasticity or a lot of flexor tone. Because when the hand flexes up, obviously it doesn't support at the elbow, so the arm's still going to drop out. But what it does do is, for those of you where your arm is still kind of in that flaccid stage or just kind of limp, is it does provide some support at the hand to help bring that arm up. It also has a little strap behind the elbow, which almost kind of facilitates a little bit of elbow extension, which I really, really like, and it does allow you to do a normal arm swing. Now, downside of it is, and those of you that have one, definitely comment in the comments what your experience is. You need like a PhD to put it on. I mean, they're a little bit confusing to get on, but once you do it a few times, it does get easier. So downside of it is it's not really good for someone that has a lot of flexor synergy, and it's really difficult to put on. Once you learn how to put it on, that gets easier. That issue is eliminated pretty much. So what is the treatment for a shoulder subluxation? First, let's go over some of the things that are tried and true. There's a consensus amongst the literature that these things are absolutely things that you need to be doing to manage a shoulder subluxation. And then I'll go over a few that some people use. Sometimes they work, sometimes they don't, but the data or the literature in formal studies doesn't really support them as much. But I'm still going to go over them because I feel like we get so tunnel visioned sometimes into only things that are documented in the research as working, and stroke's just a little bit different. The research is a little bit harder to follow. It's hard to follow patients for really long-term studies, so that's a topic for another day. But what do we know for sure 100% that you need to start day one? One is strengthening. So if you do have a shoulder subluxation, the ideal position to strengthen the shoulder to, again, prevent that prolonged downward force on the shoulder is laying down. It does several things. It stabilizes the shoulder blade, which is the bowl part or the cup part of that socket. The other thing is that it's just easier. So because the muscles are weak, you want to set yourself up for success. And laying down, because it's a little bit easier, it's going to be a little bit easier to set yourself up in an ideal position where you're going to have the best opportunity to activate some of the muscles that not only hold that shoulder in the socket, but also raise the arm. I will put a link in the description below for a video that I did on some of these exercises laying down that I'm talking about. The other thing is passive range of motion every day. So there's two ways you can do this. If you have someone that can help you do range of motion for the shoulder, that's best case scenario. I do have a video where I go over that, how a caregiver can help to do the passive range of motion for the shoulder. I'll put a link for that in the description below. But there's also self range of motion exercises that you can do to maintain the motion in the shoulder. One is while you're laying down, you definitely, again, want to do this laying down, but just grabbing onto that arm and just very gently just reaching that arm up over your head. You do want to work on external rotation just a little bit, but very gently, because it is pretty common for the front part of that shoulder to become really tight. So I love this cane exercise. I'm going to show it again for those of you that didn't see it in the 5 other videos that I've shown this exercise in. But yeah, you're just going to move it out to the side using the cane and one of these blue straps. I love that exercise. In addition to active movement or strengthening and passive movement, I also find it very effective to do some form of weight bearing. So I have done a video on how to do weight bearing on the arm. I will put a link for that in the description below. If you can get your arm straight, absolutely, I would be doing this every single day. So everything I've gone over today, everything I've gone over so far are things that you can do every single day. Now, some other things that people do where there's not really a lot of strong literature that supports it, however, it does have its place, is E-stim. So there was a meta-analysis done in 2017. And what a meta-analysis is basically when someone looks at a bunch of studies that are all asking the same question. So this meta-analysis was looking at the benefit or the effect of E-stim on treating a shoulder subluxation. And the evidence isn't strong suggesting that it will treat the shoulder subluxation, but some people did get some pain relief. So it's not that it's not beneficial, but it definitely isn't showing strong evidence that you're going to strengthen the right muscles to hold that ball in that socket. And then the other one is, and I've used it, is Kinesio Taping. So there's nothing in any of the literature, or was Kinesio Taping even designed for this reason, that suggests that it is going to pull a bone in any direction. The benefits of Kinesio Taping are to increase circulation, and then increased blood flow helps with pain and other things, but there's nothing that suggests that you're going to actually move a body part with Kinesio tape. However, because of the increased circulation, you can get some pain relief. Some people just have a little bit more awareness of that arm with just the tape on the skin, so that's a benefit of it. So again, I use it occasionally for those reasons, but it's in conjunction with things that we know work, such as passive range of motion, active range of motion, and weight bearing. So E-stim, Kinesio taping, there's definitely a time and a place for it. But I couldn't mention those things without also mentioning that there have been research studies done on it, and neither one of them have strong evidence suggesting that it will treat a shoulder subluxation or correct a shoulder subluxation. And that is it for today's video. So I hope you guys all found this helpful. Again, I get questions or comments about shoulder subluxation a lot, so I hope I answered all of your questions. If I didn't, go ahead and leave it in the comments below. I'd be happy to do a part 2 to answer your specific questions. Again, if you haven't yet subscribed, go ahead and hit that subscribe button, turn on that notification bell so that you'll be notified every time I upload new videos. I enjoyed spending time with you all today. I hope you all are having a fabulous day, and I look forward to seeing you all in the next video.